Hello, everyone, and welcome to the latest edition of the Vitality Coaches Wellbeing Programme. My name is Jamie, and my role at Vitality is Head of Health Engagement. But for today, my role is solely as the host of this session. And the topic of today's event is all about type 2 diabetes. Now, diabetes is a condition which is generally characterized by too high levels of blood glucose or blood sugar. And there are certain types of lifestyle factors which may contribute to increasing the risk and the development of type 2 diabetes. These might be things that you've heard of, such as nutrition, maybe physical activity, stress management, smoking, as well as potentially some genetic predispositions as well. It's not easy to say that. And for today's session, fortunately, we are privileged to be joined by two experts to discuss the sort of signs, symptoms. We'll look at the risk factors, we'll look at prevention and support, as well as lifestyle management, all focused on supporting you reduce the risk of developing, or if you already do have type 2 diabetes, of managing the disease for you. So firstly, I'm very, very, very glad to introduce Dr. Katie Tryon, who's the Director of Health Strategy at Vitality. And Dr. Katie, this is long overdue because we've been wanting to work with you for a while. It's your first appearance on the Wellbeing Programme. Thanks so much for joining us today. How are you?
Pleasure, Jamie, and welcome to everybody else. I am thrilled to be here. I didn't realise that you've been waiting so long to have me online, but I'm thrilled to have finally made it.
I was supposed to play it cooler with that, but
to give a short intro about myself, is that right?
Absolutely, if you could.
Well, for those not familiar, so as Jamie said, I'm the Director of Health Strategy here at Vitality. I am a medical doctor by background, but have really been on the business side of healthcare actually for the last 15 or so years, and across various different parts of the healthcare industry, from the payer side, the insurance side, through to the provider side, hospitals and groups, through to the investment side. But here at Vitality, as the Director of Health Strategy, my real focus is how we help our members to improve their health. That's the global remit that I have. And that is really everything from the prevention elements of, as you can imagine, improving their nutrition, improving their physical activity, improving their mental well-being, all the way through to then sort of managing them through to how best to manage through various different care needs that they might have. So today, I think, is a very topical discussion around diabetes and how we at Vitality help our members on the prevention and the management side, and then more broadly, kind of in the global community, how do we manage diabetes as a condition?
Amazing. That's why we've waited so long. You're the expert. We're also very grateful, though, to have our partners from Second Nature support us as well. So Robbie Puddick is a registered nutritionist and expert in type 2 diabetes. And again, Robbie, I'm going to ask you to do your introduction because I won't do you justice, but thank you so much for being involved. I'll hand over to you.
No, pleasure. Thanks for having me. So yeah, my name is Robbie Puddick. I'm a registered nutritionist. I've been working at Second Nature for nearly 4 years. My background, I started my life with a bachelor's degree in sport and exercise science. So I always had a passion for sports performance and health, and then went on to nutrition. So I did a master's in nutrition at the University of Westminster and have been working in type 2 diabetes ever since. So for the last sort of 5.5 years as health coaching, and more recently, I've moved into working with universities, so delivering guest lectures at different universities across the country in behavioural science and type 2 diabetes and exercise and things like that. And yeah, my recent role has sort of moved into more content creation, so delivering talks like this, but also writing articles online from everything from type 2 diabetes to mental health and even recently into women's health as well, which has been really interesting for me. So yeah, excited to be here and looking forward to it.
I think we're in very safe hands. So, Robbie, the plan for today is that we're initially going to pass over to you to guide us through some slides. But for everyone watching, just before we get into that, we have considered your pre-registered questions beforehand. And what we're going to do is we're going to include these throughout the conversation, as well as dedicating a little bit of time at the end as well for that. So please do bear with us. We'll try and get to as many questions as we can. But Robbie, I'm going to bring up some slides.
Brilliant.
Hopefully everyone can see that. And I'll pass over to you to lead us from here.
Brilliant. Thank you. So yeah, today we're going to be talking about type 2 diabetes, specifically pathology, which basically means root causes of the condition. So how does the disease process start and end? well, there's obviously no end, I suppose, but and then we'll be looking at lifestyle management as well. So the things that we can do from a lifestyle perspective that can help us to manage, prevent, or even put type 2 diabetes into remission in certain cases. So yeah, thank you. And yeah, what we'll cover, we'll do a very quick introduction to Second Nature. We'll then move into the question, what is type 2 diabetes? Really looking at the pathology, the root causes. We'll then be looking at, I realize a typo on this, it says 223 rather than 1234. Apologies for that. Then we'll be looking at the requirements for remission. So remission being remission, reversal, they're kind of used interchangeably, but we'll be looking at the exact definition of that in the slides as well. And then we'll be finishing off with nutrition, exercise, but we'll also be looking touching on sleep and mental health, as well as, yeah, I mean, the Second Nature program, we're all about holistic health, and very much so vitality as well. It's about the whole package and not just sort of physical health. Yeah, physical health and psychology are all interlinked. So yeah. And yeah, just a very quick introduction to Second Nature. So our kind of tagline is make losing weight feel second nature. We don't consider ourselves a diet, although we of course do have nutritional guidelines. Everyone wants a structure to follow, but we focus on the whole package. So we want people to develop a healthier lifestyle, which will help them maintain a healthier weight in the long term. We don't want people to just go on a crash diet, lose weight for 6 weeks, and then regain it all. And then just to regain it all. We want people to develop a lifestyle which brings them purpose, fulfillment, and then would inherently lead to sustained weight loss in the long term. As you can see, it's delivered completely via an app, and we are now in partnership with Vitality, which is really exciting. I think, Katie, you mentioned we've had over 1,000 members from Vitality through the Second Nature program now, which is brilliant.
I think this is a good opportunity, actually, maybe, Katie, to pass to you, just from a clinical perspective, why it was that Second Nature were the right partner for us on this topic, because I know that there's many options in this space. So what was it specifically that you thought Second Nature could help with our members?
Yeah, absolutely. I mean, needless to say, we're incredibly excited to go live with Second Nature. I think, the reason we initially approached Second Nature was a few different things. I mean, one is obviously this is a major issue within our membership base. We work obviously in the shared value model. So what is good for our members is good for us and is good for society as a whole. And, and thinking about effective and sustainable weight management obviously sits very squarely in that space. So we started looking around to see who might be able to help us in this space. And like you say, Jamie, there are a lot of different groups in this space, and a lot of people that would have been very keen to work with us. And I think the really standout thing for me for Second Nature was the evidence base, or is the evidence base that Second Nature has on how effective it is. And very much to Robbie's point, not just how effective it is in the short term, but how effective it is in long-term and sustainable weight management. And for us, that is absolutely key. It's very easy to yo-yo diet, and we've seen that obviously over the years. What is much more challenging is to get people to make significant behavior change over a period of time. And that really aligns well with us at the Vitality program. We are all about sustainable, health improving behavior change that is maintained year on year on year. So I think, we're very aligned in that mission with Second Nature. And I think it was sort of stand out. And I think the other piece to me is it's very effective, but it's also very engaging. I think the popularity of it has shown that actually this is something that people, our members want, they're actually asking us for and they want to engage in. I think the interesting thing that we've done in our partnership with Second Nature is the way in which we're getting people to engage with Second Nature. So we've included it as part of what we're calling the next best action. So what is the next best thing you can do for your health? And in the case of certain people, that is, looking at effective and sustainable weight management. And what we've done is offered them a significant number of vitality points for engagement with Second Nature, to really boost that incentive and bring that incentive of weight management forward and into the nearer term. But I think the critical thing we've done is, with that big boost of points, of vitality points, half of them you get for the engagement with the program. Mm-hmm. Half of them you get from the outcome. And, we really want people to be better managing their weight. But we really believe that actually, if you can show sustainable engagement with Second Nature, the weight management will follow.
Yeah, I think it's great. The way that we've weighted points towards the journey rather than just the outcome is what's going to lead to the longer term. Amazing. Robbie, back to you.
Brilliant, thank you. And just a little note on top of what Katie just mentioned there about the engagement. We've got a paper released, I think it was about 2 or 3 years ago, which showed a very strong correlation between engagement with the app and the health coach at Second Nature and long-term weight loss. There was a very strong correlation, as in association. So for those of you who are unfamiliar with those terms, basically means the more you engage, particularly with the health coach on Second Nature, typically the more weight loss you will lose in the long term, which is probably might sound really obvious, but many people don't take advantage of the health coach. So if you do join Second Nature in the future, take advantage of our dietitians and nutritionists. They are brilliant. Okay, so yeah, moving on. So what is type 2 diabetes? So it could be defined as a disease of energy toxicity within the cells, which basically means the body can't regulate the energy we get from food effectively. Now, we've got a little graphic on the screen here, and it's just showing a phenomenon known as insulin resistance, which we'll get into a bit later on. And this is essentially what's happening at the cellular level of type 2 diabetes across the body, not just in the muscles, in our fat cells, even in our brain. Basically, the cells are no longer able to bring the energy out of the blood to use for energy or to store for later use. And we'll get to why that becomes an issue just in a tick. So it is categorized by and a phenomenon known as insulin resistance, as I've just mentioned, and this comes across in very high insulin levels, and you develop this in the muscles, in the liver, in the adipose tissue, which is your fat cells, or just think of it as the fat beneath your skin, and in the brain as well. And that is a really interesting connection to the development of things like Alzheimer's and dementia as well. They've shown in those conditions that people have low uptake of glucose into the brain, which might be one of the reasons why that disease progresses the way it does. And there's also an impairment of beta cell function, and these beta cells are the cells that make insulin in the pancreas. So the pancreas produces insulin, releases it into the blood to help us manage our blood sugar levels. And it's typically associated with obesity. However, as we'll be getting on, not always, but particularly central obesity and what's known as hypertrophic obesity, which is where the fat beneath your skin, the fat cells that store this excess energy that we can sometimes consume, they become enlarged, and this can increase your insulin resistance in the body, and this can have a significant impact on your ability to manage blood sugar. Brilliant. So the main drivers from a lifestyle perspective, which we'll be touching on later, they're all different pieces of the puzzle. So we've got nutrition, our diet, exercise, physical activity. Remember, it's not just exercise, as in formal exercise, movement in general is really important, sleep, and what is now becoming more and more obvious is psychological health. So we used to dissociate physical and mental health, but we now know you can't have one and not the other. So the brain and the body are intertwined, and psychological health has a big impact on our physiology and how the body functions. So stress, anxiety, depression, mental health conditions all have a significant role to play in the development of these chronic conditions like type 2 diabetes as well. So this is basically what we used to think happened during type 2 diabetes. So, and this is how many people still view it. We think that you gain weight, and from this weight gain, you develop insulin resistance, and then downstream from that, you develop type 2 diabetes. So this is the previous hypothesis, if you like. And there is a strong association. So as in, the more weight you gain and the higher your BMI, the risk of developing type 2 diabetes does increase. However, if we look at this data set, we can see there's still a population of people with a healthy BMI, a healthy weight, so to speak, or even underweight individuals that develop type 2 diabetes. So if it was obesity causing the condition, people in a healthy weight shouldn't hypothetically have type 2 diabetes, but we know it does occur. And this can be explained by recent research, particularly the DIRECT trial, which was the first major trial to achieve remission. We talked about that earlier. Remission means reversal, but we can get into the weeds about some of the semantics on that on a large scale. So total weight loss predicted rates of remission. So the more weight you lost, the participants lost on this study, typically the more likely they were at achieving remission. However, but remission was dependent on liver and pancreas fat reduction. So this meant that it wasn't necessarily the amount of weight you lost, but where you lost it. And it just so happens that the more weight you lose, typically, the more likely you are to lose the fat from the liver and your internal organs. These are the essential organs that manage your blood sugar levels. Now, this indicated very strongly the importance of fat distribution in type 2 diabetes development. Now, I heard this phrase from Robert Lustig recently, and I think it's really important. It's not necessarily the fat you can see, but it's the fat you can't. So it's actually the fat within our internal organs, which is suggesting our body's struggling to regulate this food energy, which then leads to the disruption of the body, the dysfunction of the body effectively, and you can develop type 2 diabetes downstream from that. And this leads us on to the personal fat threshold hypothesis, which was, I believe, first coined maybe by Dr. Roy Taylor, or he's certainly the most prominent advocate for it. And this is the hypothesis itself. So it says that everyone has a personal fat threshold, whereby our adipose tissue, remember that fat beneath the skin, it essentially becomes full. So our adipose tissue is quite incredible. It can store an incredibly large amount of fat. Even Chris Froome in the 2017 Tour de France, at 9% body fat, they estimated he still had around 80,000 calories worth of fat stored within his body. So you can imagine, there's a very large pool of energy. But it seems that everyone has a genetically determined or defined level at which the adipose tissue, our fat cells beneath our skin, can no longer store any more fat. Then the body has to do something with it. It has to go somewhere. So what we see happen is that fat starts to increase in our liver and our pancreas. And this is when we start to see type 2 diabetes develop or accelerate at a greater pace. So this is a bit of a busy picture, but I'll try and run through it as quick as simply as I can. So this is what we would say is the nutritional pathway to type 2 diabetes. So the other lifestyle factors notwithstanding. So we typically see an excess consumption of ultra-processed foods. So, we call them convenience foods, the microwave meals, the pastries, the crisps, can be defined as junk food, but I don't really like the term junk. And what we see happen from an excess consumption of these foods that are really rich in sugar, refined carbohydrates, added vegetable oils, so added refined fats as well, and they're really low in fiber, and we can talk about why that's an issue later on maybe, it tends to lead to an exaggerated insulin response. So high insulin levels in and of themselves can disrupt the ability of the cells in the body to respond to insulin downstream. This then leads to a situation of what we would call hyperinsulinemia. It basically just means high insulin levels and increasing insulin resistance. What happens is your glycogen stores, so glycogen is your carbohydrate stores in your liver and your muscles, they become full. So that's one energy storage facility that's blocked for access. And then also your adipose tissue. So the other area of the body that we can store excess energy as fat, that also becomes full as well. We then see the excess fat has to go somewhere. The body can't just make it vanish. It then gets stored within the liver, the pancreas, and because these are the vital organs that manage our blood sugar, we then see at the end of the pathology of the disease process, that's when blood sugar levels rise. So there's this kind of misconception that type 2 diabetes is a disease of blood sugar, when really that's the end of the disease process. And high blood sugar levels isn't a good thing in and of itself too. It can be toxic to the cells. However, it's the end of the disease process. So type 2 diabetes is a lot more than just high blood sugar.
Robbie, there's a huge amount that you covered here, and I think it's really interesting, and I'm sure people might be a bit shocked at this, because I've heard so many times people say things like, you're lucky you've got a fast metabolism, you don't eat well but you get away with it, and all those sorts of things, and that's where people might mention things like being fat on the inside but thin on the outside. And Katie, I wanted to pass to you on this with a couple of questions, so sorry if I'm overloading you here, but from your understanding and from maybe the Vitality member base or research, are you able to tell us a little bit about what percentage of kind of like the correlation between BMI and those with type 2 diabetes? So what numbers are we looking at here that might still have a healthy BMI but then develop type 2 diabetes? Like, what is it very small amount of people that might have that? And second to that, for those people that are watching that maybe slightly younger or whatever age they are, don't necessarily eat as healthy as they potentially should do, but they don't have signs of diabetes, or they're not overweight, so they don't feel like they're at risk. How do you support those people who can't see a risk change their behavior? So two parts to it, like how many people are we talking about with a high BMI or a low BMI that will get type 2 diabetes? And secondly, for those that are not overweight but still at risk, how do we help them change their behavior when it's not obvious?
Yeah, absolutely. Thanks, Jamie. I mean, I think on that first question, in terms of how many, I think what we see within our member base actually is, and the only comparator I've got really is against national statistics. And when we compare our member base, in general, I would say we have lower weight to height ratio, however you want to measure it in terms of BMI, etc., slightly lower than the general population. And we also have a lower declared rate of diabetes. So I think that's, and that's poignant for us. And I very carefully say declared for a few different reasons, because, we know what our members tell us, and they may choose not to tell us, that they have a condition such as diabetes. So we suspect the numbers are probably higher than, than we've got or that we understand. I think, the more we have programs like Second Nature to help people to manage their conditions, I think potentially the more people we will find have those conditions within our membership base, in all honesty. But we've certainly seen, and increasingly so since we've been working with Second Nature, we do have a significant sort of sizable population within our member base who have a high waist to height ratio, or BMI, or however you measure it, and we also do have a significant number of members who have diabetes. So as I say, I think that will increase with with the more programs that we have on offer, in all honesty.
Amazing. Yeah, I think it's one of those things that we probably, maybe a lot of people, I looked at the stats before, and you're looking at a vastly higher number who are at risk or potentially have got type 2 diabetes but just don't know about it yet. And I know we're going to come on to signs and symptoms, but is there a message, Katie, based on that you would say to people about at that point, like how to look at themselves and just maybe understand a little bit more about their risk factors personally?
Yeah, absolutely. I mean, I think the key thing really, the key thing with diabetes is that unfortunately, if you look at Robbie's diagram there, by the time you're getting to the point that there's glucose in your blood, you've run quite a long course already, and so the challenge with diabetes is really before you get any signs or symptoms, quite a lot of change has been going on. So, I think to rely on symptoms, and obviously a lot of times they say, you feel excess tiredness. Well, anyone like me who's got young children and works hard feels quite a lot of tiredness, quite a lot, and things like that. The symptoms are quite vague, quite insidious, and I think that's the challenge with diabetes. So what I would encourage people to do, and we do through Vitality, is offering screening. Whilst the glucose level within your blood is down the line, it's still a very valuable sign to be able to pick up on. So thinking through getting blood glucose screening, I think, is important. The other element is also to look at your various different lifestyle measures. What is your weight relative to your height? What is your nutrition like? We've got our Vitality Health Review where you can get feedback on, how good is your nutrition in terms of how healthily you're eating. What are your levels of physical activity like? Actually measuring that against what are nationally recommended guidelines for the amount of physical activity you should be doing. Looking at your mental well-being. Again, within the Vitality Health Review, we have a screen for your mental well-being to sort of understand how you're feeling mentally as well. And I think it's very important to do these reviews to get a screen of where you are and where your metrics are, and potentially where you should work, both for diabetes prevention, but also just generally holistically for a picture of your health and what areas you might want to look at for your health improvement.
Amazing. I will we'll definitely come back to the Vitality Member Health Check as well a little bit later on, but I think that's a great place to start. Robbie, insulin, you mentioned it a few times. Tell me more.
Right. So yes, this phenomenon of insulin resistance, and this is probably the most important thing to understand today, because it's the condition that underlines the condition of type 2 diabetes, but it's also causally linked to many other health conditions as well, and it's something we want to try and avoid or prevent or treat if possible. So we like to use an analogy called the lock and key. So the way insulin works is it acts like a key. So we defined it earlier as an energy storage hormone. So what happens is when we eat carbohydrates in a meal, glucose levels rise in the blood. Insulin acts like a key. It unlocks the door called the insulin receptor to the cell. This could be in your liver, your heart, your muscles, your brain, your adipose tissue. And it brings these glucose transporters to the surface of the cells. They're called GLUT4, but let's just call them glucose transporters. And then the glucose is able to enter the cell. That's how insulin works. It's brilliant. Without insulin, we wouldn't live very long. It's absolutely critical for our survival. However, in insulin resistance, what tends to occur is when we have excess glucose in the plasma, we mean the bloodstream, really high levels of glucose due to a diet high in ultra-processed foods, due to lack of sleep, due to high levels of stress, that kind of thing. What tends to happen is the amount of insulin becomes higher as well, because the pancreas has censored how much glucose is in the bloodstream, so it sends out more insulin. But the problem comes is with the more insulin in the blood, in the body, the insulin receptor, the doors don't seem to respond as well to the key. They become a bit fudged. So they've done some really interesting studies where they've used what's known as a high insulin clamp, where they intravenously, so they inject people with levels of high insulin for say 24 hours to see how the cells respond to the level of insulin. And high insulin in and of itself actually lowers the activity of those insulin receptors, those doors to the cells effectively. So what does the pancreas do? Because the doors become clogged, the glucose is struggling to enter the cell, the pancreas sends out more and more insulin. More and more insulin causes more and more insulin resistance, and the excess glucose in the blood remains high. So I hope I've explained that well enough. I hope that makes sense. But yes, that's effectively what's going on. So it happens in the muscles, it happens in the adipose tissue, the fat cells, it happens in our organs, in the liver, in the pancreas, it happens in the brain as well, as we mentioned earlier as well. And it's not just an issue with glucose transport, there's lots of other complications to it as well.
Amazing. Robbie, in terms of insulin, so just to clarify the understanding, so all of the storage spaces for your blood sugar, your energy to go, have been fully used up. Insulin is what the hormone that's released to transport the glucose from the blood into the cell. When you've got too much of that pooling, your pancreas releases more insulin, which then clogs up those keys, which means that the glucose has nowhere to go and it ends up pooling in the blood, and no one's winning in that situation.
Exactly. And to kind of tie it back to the process we talked about earlier, when that happens sort of peripherally, if you like, in the muscles, in the adipose tissue, that's when the body's like, okay, this glucose, we need to get it out of blood. So we have a very tight threshold at which the body wants to keep glucose. So I think off the top of my head, it's 4 to 7 millimolar, I think. Katie might have to confirm my numbers, but that's the level at which the body wants to keep glucose. So that's a nice, happy level for the body. It's not toxic to the cells, and it's high enough to keep energy delivery stable to all the cells in the body, the central nervous system, etc. But when it's too high like that, because the glucose has got nowhere to go in the rest of the body, it has to go somewhere. So that's when it has to end up going to the liver, to the pancreas, and that inherently makes the whole situation even worse as well. So yes, it's very, very complicated, and there's a lot going on. But I hope that makes sense.
No, it does. It makes total sense. And I'm going to pass over a question to you, Katie, if that's okay, because if you are a Vitality member, and Katie mentioned the Vitality Health Check, as part of that, you'll get screened for your blood glucose, cholesterol, height, weight, BMI, and blood pressure. And the threshold, Katie, that we use for glucose is 7.8. If you're above 7.8, you won't get a green next to your score. It will be amber, it will be red. But based on that number is not necessarily like, oh, if you're above, you have diabetes. If you're below, you don't have diabetes. So I wanted to ask you a couple of things on this, if that's okay. And forgive me for bombarding you with like 3 questions at once. But essentially, if you have got a blood glucose reading of above 7.8, what does that mean? Like, does that mean you're diabetic? Second to that, what's the next process that happens after that point? Like from a journey perspective, if you're someone, where do you go next? And then the third part is, I can repeat any of these, by the way, is Robbie's just mentioned there about what happens if you've got this excess glucose in your blood, but are you able to explain to us what those longer term risks might be and what the health implications of that could be as well?
Absolutely. I'll start talking. If I forget the last question, you might just need to remind me.
It's my fault. Yeah, of course.
No, it's a great question, Jamie. I think the key thing is what we're measuring in the Vitality Health Check is a random glucose. So it's not what we would call a fasting glucose, which is when you're told not to eat for a period of time, because obviously your glucose level does rise after you've eaten because glucose goes into the bloodstream. So, you know, to get a more accurate measure of how you deal with glucose, it would be a fasting glucose. What we ask is a random glucose, because this is a health screen. This is not a diagnostic tool. It's a health screen. So what I would say is if you do have a raised sugar level in your health screen, it is an indication that you should undergo more tests. It is absolutely not a diagnosis of diabetes. It is saying that's quite high for the average individual. You might have just had a meal. You might have just eaten 4 Lucozade tablets, you know, in which case your blood sugar is going to shoot up. But you know, if you do get a raised number, it is just something to go and look at and undertake further investigations. So that takes me to your second question, which is then what happens. So the really key thing here is to go to your GP, to your NHS GP, and you say, I've had a raised, you know, random blood glucose. It probably needs further investigation. And they, from there, will undertake a series of different investigations, including what I mentioned of fasting glucose. So to make sure that really when you're not eating anything, what does your glucose level look like? And then on an ongoing basis, you do something called an HbA1c, which is a measure of what your average level of sugar in your blood is over a 3-month period. It's to do with the sugar that attaches to your red blood cells during that period. So those are the sort of metrics that will determine whether you do have diabetes or not. It wouldn't be the screen of a random glucose. And so the process of diagnosis for diabetes is a relatively long and detailed and convoluted process to be able to get to that point. And it's very important because once you've got to that point, you know, there are basically sort of 3 routes. You know, one is you might be able to manage it with lifestyle alone. So making some of those big lifestyle changes that we've talked about around physical activity, around weight management, around nutrition. 2 is you may need medication to support that. You would still need to do the lifestyle changes. They're absolutely core and critical to any change that would be suggested. But then there's a range of medications that could support that. And then 3 would be, again, lifestyle change is critical, but potentially supported by insulin, because where Robbie, the next stage after Robbie was talking about too much insulin is then you really exhaust the body and your body can't produce enough insulin. So in some cases you actually, it sounds counterintuitive after what Robbie just said, but you actually need insulin to do its job. Right. So, you know, these are big decisions, and these are not decisions made on a single random blood glucose level. You know, these are big decisions around, have you got diabetes and what is it? Where in the spectrum of diabetes do you sit? Because, you know, as you've seen from Robbie's pictures, it's a very long process, diabetes, and people can be at very different stages depending on, you know, the evolution of the condition. So, you know, you really need to get to the bottom of where are you on the diabetes spectrum, and therefore what is the best management for you at any given moment. I do actually remember your third question, Jamie, and I can go onto it. I'm impressed even after that I can remember. So my third question, your third question was around then, what are the consequences of diabetes? And this plays into what do you need to look out for. So the key thing is that toxic level of glucose in your blood. So the really key thing when anyone is trying to manage their diabetes is managing that end state, that glucose level in the blood. And whether that is, by making significant lifestyle changes, medication, or insulin, that's what you want to have as a consistent change. Because what really happens then in diabetes is the impact that can have on your cells. And so what you see down the line is it can have an impact on your cardiovascular system, so your heart and your brain system, and how blood gets to your key organs like that. So, you can see consequences there. You can see consequences in eyes and your vision, which is why it's very important for diabetics to have regular eye checks. And again, that's all to do with the blood getting into the retina, into the back of the eye. So that's really key. And then the third one is it can have a heavy influence on your nerves, and so your feelings and your sensation. So one of the key things for diabetics is to have what we call a foot check to make sure there are no ulcers, because their feeling and sensation on their feet can be compromised by the condition because of that toxicity of the sugar. So it's been very important that for anyone who does have diabetes, that they are really managing that blood sugar level tightly. And either in the very short term if they're using insulin, or in the longer term with that HbA1c that I mentioned, that's really looking at your average level of sugar over that period, and then getting your regular checkup, so your annual checkup to make sure your cardiovascular system is working well, your eye checkup to make sure that there's no compromising of your vision, and your feet checkup to make sure there's no compromising on your foot health because of compromised sensation.
Katie, perfect answers, and I promise I'll try and ask one question at a time from now on. I think, Robbie, we've covered so far kind of like the pathology of the disease and the risks, and I think we've hopefully given people a really good understanding of that. Second half, again, this is where maybe more of the members' questions have come in around what can we do if we have diabetes? Is it reversible? Looking at nutrition and lifestyle factors like you both mentioned so far. So I guess first place to start, as it says on the screen, is it possible you do have type 2 diabetes to reverse that?
Excellent. So so the question to that would be, it is possible, but it's not a guarantee. Let's dig into that. So the definition of remission to start with. So this is the consensus guideline from the UK Primary Care Diabetes Society and the Association of British Clinical Diabetologists, a bit of a tongue twister. And they lay out three criteria for remission of type 2 diabetes. So weight loss. Now, if we go back to the pathology, weight loss technically isn't required, but it does improve your chances. The essential criteria being weight loss out of those internal organs that are managing your blood sugar levels. A fasting plasma glucose less than 7 millimolar a litre, or HbA1c, the average glucose that Katie was talking about, below 48 millimolar per moles, on 2 occasions separated by at least 6 months, and then the discontinuation of all glucose management medications. So technically, if your blood sugars are back to normal, but you're still on metformin, or you're still on Archibos or anything else, or insulin, you're technically not in remission. But obviously, as Katie alluded to, with a normalization of blood glucose levels, you will be much healthier. But to technically be in remission, these are the criteria that you need to meet. And this is where we get to the kind of back to the physiology of the pathology. So what do we see in type 2 diabetes remission? Well, going back to the direct trial, this is what we see. We see a reduction in liver fat significantly. We see a massive reduction in liver fat export, because obviously if the amount of fat in the liver is very low, it doesn't have to try and get rid of as much. And then the levels of pancreas fat also go down. And then we see the beta cell function return to normal, which means when you, as Katie alluded to, and I'm really glad Katie brought this up because it is something I forgot in my slides, is that at the end of that disease process, counterintuitively, the beta cells' ability to produce insulin actually goes significantly down, which is why people with type 2 in very serious circumstances do need insulin injections. So we see this return of beta cell function in the pancreas, where the body is able to release the right amount of insulin in accordance with the amount of carbohydrates you're eating with your diet. And I've circled this in red because this is the kind of the the defining endpoint to whether you will achieve remission, medication-free remission, I suppose. And if we move on to the next slide. So this is where we look at responders and non-responders. So this is basically what we see. In responders to the effective weight loss and the reduction in liver fat, you see, and non-responders, you see liver fat falls in both, pancreas fat falls in both, but the responders, their insulin levels return to normal, their beta cells, their pancreas function returns to normal. But in non-responders, when their blood glucose levels rise, their insulin levels don't respond. So they're still unable to manage their glucose levels through the production of insulins from their beta cells. So this is really interesting, and there's still more research going on to see what's going on, but it's hypothesized that if you have diabetes for a very long time and your beta cells have been dysfunctional for a very long time, your pancreas fat has been high for a very long time, it's more likely that their function might not return to normal. And there's other factors at play as well within the pancreas. There's these enzymes, these molecules that sense the amount of glucose in the bloodstream. There's evidence that they also fall. So it might be in relation to those not coming back to normal as well. But what I would say with this is that even if you're an unlucky individual who's a non-responder and everything else is looking good, but you have to stay on insulin injections or an insulin pump because your pancreas isn't functioning as it should, that's still a dramatic improvement in your health compared to before, when you had type 2 diabetes and your liver fat was high and your blood sugar levels are out of control. Even if you're a non-responder and you have to stay on insulin for the rest of your life, say in worst case scenario, your health is still very much improved because your blood glucose levels are in a healthy level, your liver fat has fallen, your pancreas fat has fallen, and your entire cardiovascular system is basically improved as well. So yeah, that's the kind of crux in the remission question, I suppose.
Yeah, it's an interesting one, isn't it? That if you're a non-responder, it's still just as important to focus on all the right things. And I think that's a good segue to maybe dig into a little bit more of the practical things that we can do now to manage risk and also symptoms if you are diabetic.
Absolutely. So starting with nutrition. So, I mean, I'm sure a lot of your members have heard, about low carb diets, low carbohydrate diets, Mediterranean diets. And effectively, what I would like to say is that any dietary approach, and I've got the key message here, whole food approach, any dietary approach that has got a whole food foundation, which means a very low intake of ultra processed foods and a high intake of whole foods like fruits, vegetables, nuts, legumes, meat, fish, dairy, etc. Basically a diet rich in fiber, rich in protein, rich in healthy fats, and rich in high fiber carbohydrates, versus the ultra processed diets we were discussing earlier, which are devoid of fiber, devoid of protein, and high in refined fats and refined carbohydrates. So there has been a lot of research looking into, say, the best dietary pattern for people living with type 2 diabetes. And there does seem to be an advantage in the short term. I would kind of highlight those terms. In the short term for lower carbohydrate and Mediterranean. Now, Mediterranean diets are probably just as effective, I would say, as lower carb. They do have a bit more, a bit of a higher intake of carbohydrates generally, but this meta-analysis suggested that lower carb Mediterranean are the kind of best approaches we can take when living with type 2 diabetes at that moment. Now, what I would say with that is it doesn't mean that people need to eat in a certain way forever. It's just that what we're looking at here is short-term data. So they're looking at outcome measures, fasting blood glucose, HbA1c. We're not looking at sustainability and adherence and all that, or everything else that a healthy diet should consider. So yeah, I mean, there does seem to be an advantage for lower carbohydrate diets, particularly Mediterranean as well. And interestingly, low fat diets, which are inherently high carbohydrate diets, seem to have the least beneficial effect on lowering blood glucose levels and HbA1c, at least up to 6 to 12 months. And this has been reflected in the NHS as well. The NHS is now utilising low carbohydrate programs as well as low calorie interventions for people living with type 2 diabetes. And of course, I think there's a lot of debate about the best dietary approach amongst nutrition health scientists and doctors, but I think everyone can agree the Mediterranean diet is fundamentally very, very health promoting, and we can take a lot of inspiration from it too.
Yeah, Robbie, we've had a lot of questions on this topic, so if you don't mind, I'm going to concentrate on a couple of questions. Katie, obviously we're moving in the direction of personalizing nutrition and medicine and making everyone's getting the right needs for whatever they do. And I guess this is where this conversation and this topic gets quite tricky for people when you're looking to select the right diet for them, because we could all eat exactly the same thing here, but it would only be healthy for one of us because we've all got different requirements and different needs. So we've had so many questions about fasting, about ketogenic diets, about avoiding meats and looking at vegan and vegetarian options and all those different things. So as a general, how would you explain to people about how to approach their diet and help them understand what's right and what's best for them?
Yeah, well, I mean, I think from a vitality perspective, our view is, a balanced, healthy diet. And I think, what I like in Robbie's slide there is the whole food approach. I think that's incredibly important. And I think regardless of the diet that's being followed, being able to balance your fruit and vegetable plus your carbohydrates plus your protein in a safe and effective manner, I think is critical. I think you can weigh in and out each week on whether blueberries are in or out. Fundamentally the kind of the basic mechanics of what a healthy diet looks like are reasonably universal, I would say. The other thing that I think is really interesting that we've done at Vitality is around our partnership with Mindful Chef, because I think there's something very interesting in the process of encouraging cooking. And being part of the creation of food. And I think that's something that I'm really happy that we're promoting outside the diet. And Mindful Chef is very focused on healthy, balanced diets within it. But I also think the idea of encouraging people to engage in the cooking process and using, raw ingredients to create meals and thinking about what's going into them so that you are thinking about that. What is my balance of my fruit and veg, my carbohydrates and my proteins, rather than, instant meals that you don't have to think about what are those core ingredients. I think that's been a really interesting development. I mean, obviously we have our Waitrose partnership around those healthy food ingredients. And I think that's incredibly important. It gives people quite a lot of range and option. But I think that Mindful Chef process of encouraging people to actually undertake the cooking themselves, I think is a very important part of this healthy attitude towards nutrition and food.
I think there's a really key point there as well, is that there's going to be so many people that hear so many different things, and I think it's incredibly difficult to understand what's right for you. And what you've both explained there is just a wholesome, nutritious diet, and that's we'll show what that looks like in a second. I know we're going to come to that. I think it's just one of those things that you've also got to understand yourself, but what both Dr. Katie and Robbie have spoken about there is the sustainability, and health looks more than just what you eat, it's how you approach it. So that's why cooking is important. That's why caring about your ingredients and all those different things come into it. So for everyone that has had those questions, I think it's a really interesting one, and I completely appreciate the challenges there are because there's so many different pieces of information. But as a whole, we just bring it back to the basics, and what we'll cover here today is what the body needs, and hopefully that will just give you enough of a place to start. So Robbie, I'll let you cover this, but then I know we are going to get into the practicalities as well.
Brilliant. Yeah, thank you. And I think what you were saying earlier, Jamie, about the individualization. I mean, I am both a public health and a sports nutritionist, and when I work with private athletic clients, they're on a moderate to high carbohydrate diet. When I work with individuals living with type 2 diabetes, they're on a lower to moderate carbohydrate diet, at least during the process at which we're trying to help them achieve remission, management, etc. So yeah, it's different horses for different courses. There's lots of different approaches. And again, it comes down to sustainability and those lifestyle habits. Like Katie said, good nutrition starts in the kitchen. So yeah, the cooking element and the healthy habits are incredibly important. But just to kind of reiterate what the evidence does suggest, at least in the short term, it does suggest that you are more likely to achieve remission through a lower carb approach at present. But again, like lower carb can be reflected across any dietary pattern. So at Second Nature, we work with people who are vegan, vegetarian, from South Asian backgrounds, from Eastern African backgrounds, from white Caucasians, Europeans. So it can be applicable in all individual cases. And I think on the next slide, we'll be looking at the kind of foundation at which we work at Second Nature. So carbohydrates, we focus on high fiber carbohydrates as much as possible. So they're your whole grains, your potatoes, your quinoa, your brown rice, etc. The reason this is important is because fiber is incredibly satiating. It helps keep you feeling fuller for longer. And talking about blood sugar, it helps to manage blood sugar too, which is brilliant. Then we've got about a quarter of the plate we recommend to be protein. And this, whether this is meat-based, fish-based, vegetarian-based, or vegan, like tempeh or tofu, any healthy, rich source of protein, at least a quarter of the plate there as well. Now, protein is absolutely essential at every meal. So we want this at your breakfast, lunch, and dinner, and generally with carbohydrates too. And then we kind of say go teetotal on vegetables, right? Particularly non-starchy vegetables. Just shove them on your plate as much as you can possibly consume that you enjoy. Cooking them is generally better. It helps to improve digestion. It helps to improve the availability of the nutrients within those vegetables too. So just wilting spinach, for example, increases the amount of iron that your body can absorb, which is obviously very positive. And that's very similar across the board with other nutrients too. And we want to encourage people to consume fat in their meals as well. So whether that's coming from avocado, extra virgin olive oil, coconut oil, maybe some butter, maybe some nuts and seeds, nut butters, cream. We want people to feel like they can include fat within their meal. And we generally recommend people eating until they're comfortably full. So with this guideline, in talking about individualization, this is like the foundation at which we recommend a dietary pattern to kind of function, but then it will depend on the individual. So if I did a Q&A with a fellow health coach this week, and Gemma was talking about an individual who at the start of the Second Nature program, she was eating quite a low carb diet, but after 3 months, she'd lost weight and her blood sugar levels had normalized. And they slowly started adding in more carbohydrates as her physical activity increased and she felt more comfortable as well. So it can change depending on the situation. It's fluid, it's flexible, and just having this foundation that you can see in front of you gives the individual and the health coaches, the nutritionists and dietitians, the ability to kind of, flex it as and when required, if that makes sense.
Yeah, I think it does. And that kind of almost all those dietary questions, this maybe just clears all of those up at once, maybe.
Absolutely. So hopefully I think you said, Jamie, will be sharing these slides with everyone after. So I've added a link and I think they'll be coming through as a PDF. Now on the Second Nature website, there's meal plans that you can follow just to get a feeling for what a varied, healthy, balanced diet looks like. So you can click on this link and it's got a 7-day meal plan. Again, this is a similar kind of meal plan you produce using the Second Nature app. And it might just give you an idea of what a healthy, varied diet looks like, for sure.
Amazing. Yeah, definitely encourage people to do that. And as time is going quite quickly at this point, in the final 5 minutes, I know we're just going to cover some of the lifestyle things. And I think it's important to say to people, like, this session is an introductory session. Like, hopefully we can guide people in lots of different ways. But again, there's a big lifestyle element, Robbie.
Absolutely, 100%. And with exercise, we'll sum this up pretty quickly. It improves insulin sensitivity, so it reduces that insulin resistance we were talking about earlier. It improves fat distribution independent of weight loss, which means people that exercise more tend to store more fat under their skin and not in their internal organs, which is a very good thing. And we generally recommend, in the ideal world, a mix of cardiovascular exercise, walking, running, swimming, cycling, strength training, whether that be body weight or classes or you lifting weights, and doing some high intensity exercise. That's ideal. But really, it's about behavior and what is sustainable. So we recommend just do what you enjoy. Some people just like walking their dog every day. Brilliant. That's a wonderful way to get exercise. And there's no reason why they should feel like they have to go to the gym and do high intensity if they don't want to do that. So yeah, that's generally. And we've got, again, another link. Feel free to go through to our website. We've got a long list of videos and recommended exercises that people can do from home, in the garden, out in the park, etc.
Amazing.
Excellent. So yeah, sleep, another huge factor. So again, sleep is intertwined into the function of the body. So insulin resistance is very much related to sleep as well, through the actions of the stress hormone cortisol. And yeah, I mean, generally 3 key tips that we recommend people to help have a healthy sleep routine is, hygiene, I should say, sleep quality, is a consistent sleep routine if possible. So trying to go to bed at the same time each night, waking up at the same time each day. That seems to bode very well for what's known as our circadian rhythm. So that's the way our body functions in line with natural sunlight. Avoiding technology about half an hour to an hour before bedtime is generally a good idea. Try reading, try journaling, try listening to a podcast just to wind your body down. And it helps to kind of decompress your mind, if that makes sense. And being mindful of caffeine intake. So there's a strong association between afternoon caffeine intake and disrupted sleep patterns and sleep quality. We generally recommend people, if they do consume caffeine, to try and avoid it after midday. Try and switch to decaf, herbal teas, water would generally be a good recommendation. And again, there's another link that people can click to, and they can read about in a bit more detail, and hopefully that starts to make a bit more sense too.
Perfect.
Brilliant. And yeah, finally, psychological health, incredibly important. I mentioned earlier, it's really interesting that mental health is strongly associated with poor physical health. And just to kind of highlight that, a recent study released using NHS data showed that severe mental illness was the 3rd biggest predictive risk factor for heart disease, ahead of many of the traditional risk factors for heart disease. So it really shows that psychological health and physical health are not separate, they are intertwined, and we should treat them in that light. So just some general tips on supporting mental health. Oh, sorry, Jamie, could we just go back to just number 1, like seek support and talk, very important. Journaling has been shown to be very positive. Meditation, again, really positive. Accessing nature has been shown to be extremely effective at supporting mental health. And one of my favorites, spend time with your loved ones. And that's it.
Amazing. I got too keen on the clicking there.
It's all right.
We have covered a huge amount here, and I appreciate that there's so much here. So I've got a couple of duties to do at this point. So if you are a Vitality member, please do make sure that you head over to the member zone. And if you complete your health review, that will determine whether or not you're eligible for the Second Nature benefit or not. So if you are eligible, you will then need to sign up to Second Nature through member zone. You will then be able to complete a 12-week weight loss program. And members, like Katie mentioned earlier, can earn up to 2,400 Vitality points by completing their personalised journey. But then also, after you're completing your programme, you can access the Second Nature app for the rest of the year as well, which I think is a huge benefit, and all those links that Robbie's just covered. And outside of that, if you're a Vitality member anyway, we would always strongly recommend that you use your Vitality Health Check benefit. So whether you do that with Bluecrest or with their partners, make sure that you do that and you get a better understanding of your blood glucose, cholesterol, blood pressure, height, weight, BMI, but you can also talk to a professional as well who'll be able to help you on all of those things. Both of you, we have covered a huge amount today. Thank you so much for your time. Dr. Katie, thank you for joining us. Please do come back again, similar to you, Robbie, as well. I think that the last thing that I just wanted to wrap up on saying is that this content is hugely valuable to so many people. So whether it's for yourself or with other people, I think we all do have a responsibility to improve and increase our awareness. So please do share this content far and wide. If you're watching on YouTube, please do like, subscribe, and share, all those things that you're supposed to say now. But I'll just finally pass over to you both. Robbie, say thank you to you, and Katie, I don't know if there's anything finally to add before we sign off.
I think really, again, to reiterate, to say a huge thank you to Robbie and to Second Nature as a whole for, for walking this journey with us. And I think, we're relatively new in our partnership with Second Nature, and, I'm really excited to see where together we can go, because I think our Vitality members are already benefiting enormously from the relationship, and I think we'll only do more so as we go forwards. So thank you, Robbie. A really huge thank you for being here today and for partnering with us in this.
No worries. It's been a pleasure, and yeah, like you said, it's the start of an exciting journey, and I hope this is just one of the many things that we can do to bring accessible and practical health information to more and more people. So yeah, it's been a privilege. Thank you.
Amazing. Thank you both, and for everyone watching, thank you for joining us. Take care, and we'll hopefully see you again soon.